Begin as we do each time we get together. I want to just take a look at two charts here this afternoon. What I actually pulled this afternoon was I wanted to look at 3-week numbers versus just 2. A lot of times we're looking at 2 weeks. What you're seeing here is our 3-week new daily case trend, and you'll see the obviously the Thanksgiving bump right here with no reporting on Thanksgiving. So. Cut this in half, just call that 345 a piece, we'd be right in there. And so continued positive trending, I guess, in the number of new daily cases, and that also has corresponded somewhat to the hospitalization number that has been slowly decreasing as well over the last 3 weeks. Now, census is still extremely high, as you're going to hear in a little bit. Obviously, this is a positive trend that we like to see. Only the second time in the last 3 weeks we've been at less than 190 COVID inpatients between our two primary healthcare partners. So good news, but we'll see what sort of diligence was practiced over the last week, and we'll see what these numbers look like a week from now. I was thinking yesterday as I watched the Vikings pull it off, which is very rare. Vikings have a history of not finishing well, and I grew up in Minnesota. I've been disappointed for many years being a Vikings fan, and so as we move into December, I just couldn't help but think about how important diligence will be to us, and finishing well over the next couple months, because I think sometimes people see some positive trending or some positive information, and you want to let your guard down. And really, right now, we have several more months of mitigation that we really have to practice. And it's easy to get too much hope and optimism when we talk vaccine. That's still several months off for the general public. And so remaining diligent and finishing well over these next couple months is going to be very important. And how do we do that? That script has not changed at all. That's wearing these masks in public. That's distancing. That's avoiding social gatherings, small social gatherings when you let your guard down. That's hand hygiene. And then it's also not necessarily a mitigation spread technique, but shopping local right now and supporting our local retailers and local businesses is really important this holiday after a tough year our business community has had. So you're going to continue to hear mask up marketing efforts, PSAs coming from the city. We are continuing to run those, and we'll have more of those coming in the weeks and months ahead as we move into winter. So with that, I'm going to turn it over to our Public Health Director for the City of Sioux Falls, Jill Franken.
Good afternoon. So we continue to hear more and more encouraging news about COVID vaccines coming to us. Pfizer has filed paperwork for an emergency use authorization, as we know, and Moderna just announced today that they're also filing. They'll file today. Several additional steps, though, must be taken before we see vaccine in our community. In addition to the FDA's approval for the emergency use, the ACIP, or the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, has an important role to play in vaccine approvals. This committee is comprised of medical professionals and public health experts, and it is this group's responsibility to develop recommendations on how to use vaccines to control disease in the United States. They'll be meeting tomorrow to vote on who should be the first to receive the initial doses of the vaccine, as well as how the rest of the populations will be prioritized in other tiers. These are based on principles that they have developed to inform them as to their recommendations. And these set of principles include, one is maximize the benefits and minimize harm. This should go without saying, but vaccines should be able to reduce COVID infections. It should reduce morbidity and mortality, or decrease deaths and disability due to COVID. It should decrease the strain on the healthcare systems, and it should preserve essential community services. It should also promote justice, and so it should ensure that any barriers are removed so that all persons who are identified in each tier have access to vaccination. It should also mitigate health inequities. So inequity is due to social position and other disparities that are linked to COVID-19 should be reduced. And then it should promote transparency, openness, and publicly available decision-making process and vaccine allocation plans are a priority for them. For example, their meeting tomorrow will be public and live streamed. So while this process unfolds in the days ahead, and as we wait for vaccine to arrive, I urge you to do as Mayor Paul indicated, to continue those mitigation measures we've been asking you to practice. And finally, last week I asked you to take a moment and ask yourself, how are you doing? I encourage you to do what's best for your health right now. And we know that there are things that are very simple and really very important right now that you can do to make sure you're in the best physical health possible during this time. We know that you should be eating right, you should be getting rest, you should be moving your body and getting exercise, all things that can help you fight any disease and illness, let alone COVID-19. They can also help you with fatigue, anxiety, and sadness. So through the city's Live Well program, we do have information available on our livewellsiouxfalls.org site. And you can also call the 211 Helpline Center to get assistance as needed. And also, I would urge you, if you need help right now, contact your healthcare provider. And lastly, because influenza is still very sporadic across our state, it is a really great time to get your flu shot if you haven't already done so. So be well and stay safe. And now I'll turn it over to Dr. Mike Wilde with Sanford Health.
Good afternoon. At Sanford Health, we continue to see a remarkable number of patients throughout our health system. The number of people hospitalized with COVID-19 continues to hover around that 80 to 100 mark and has been stable over the last couple of weeks. We're optimistic about the significant impact of a safe and effective COVID-19 vaccine like Jill was alluding to. Information on the vaccines we've shared with experts, infectious disease experts within Sanford amongst ourselves and with the state and city as well, and again are very optimistic with that. We've been planning for distribution of the vaccine, and our teams are working tirelessly to identify populations and the logistics of providing the vaccination. We'll continue to learn more about the vaccine in the coming weeks, and hopeful to get those vaccinations out to the first populations in the coming weeks as well. In addition, we announced last week that Sanford Health has launched outpatient therapy centers for high-risk COVID-19 patients with a goal of improving outcomes and reducing hospitalizations. Bamlanivimab has shown to prevent certain high-risk populations from developing severe illness from COVID-19 and keep patients out of the hospital. We, in the last week, have started providing that medication as well under an emergency use authorization. With these positive things in the very near future and upon us, like the mayor said, now is a good time where I think we saw some fatigue with the pandemic, and we're still fatigued with the pandemic, but I also have seen a wonderful energy around taking care of yourselves like Jill Franken was talking about, and thank you for that. We have called upon our communities to do their part by wearing their masks, physical distancing to slow the spread of the virus. The best way to reduce stress, that is the best way to reduce stress on our healthcare system. And like Jill alluded to, the flu season is here, and it's still a great time to get your flu shot. With that, I'm going to turn it over to Dr. Basil from Avera.
Thank you. So as we go into this week after Thanksgiving, I remain very thankful, especially for graphs like this. So really for the first time in about 3 months, we've seen kind of a leveling off of cases and hospitalizations, but they're leveling off at a very high level still. And that is a direct result of the public really taking it to heart and upping their game on masking, distancing, and probably most importantly, when they have symptoms, isolating, getting tested, and if they're exposed to somebody, quarantining. We've seen that level of all of those activities increase, and that's a direct result of now where we're kind of leveling out on our admissions. But we have to sustain now, and so we can't take our foot off the gas or things will just start right back increasing again. And so until we get that vaccine, which probably is weeks to months away for the general public, then we've got to keep on going. Also, you talked a little bit, Jill, about the vaccine and some of the ethical principles, and you mentioned transparency. And so I wanted to bring a little bit of attention as you start to hear some of this data come out in the news. I wanted to put a little bit of it in perspective on a couple different points. First off is this is a vaccine that at the effectiveness levels that it's been showing will likely prevent tens and even hundreds of thousands of deaths. And so when you start seeing some of the safety data, when this starts being given to, 100,000, you're going to see case reports of, one person gets an allergic reaction and really has a serious adverse event. Or maybe somebody gets a case of Guillain-Barré or some other serious adverse event, which thankfully we have not seen any of those yet, but we will. I mean, we expect that on any type of therapeutic. Even Tylenol will give a certain number of that. When you start seeing a few of those case reports come out, balance in your own mind, tens and hundreds of thousands of people that are benefiting and aren't dying because of it, and a handful of people that have bad reactions. And so I want to urge the public to keep kind of that balance in your mind. Also be reassured that we continue to meet following the ACIP, the CDC's guidance on those allocations, especially looking at some of those justice and equality issues about people that don't have transportation. How are they going to be able to get the vaccine? Maybe we have to go out to the homeless to get the, what a high-risk population that is proven to be with this, to get the immunization brought to them or to somewhere that they go frequently, the homeless shelters or whatever that is. And so those are the types of conversations we're being had today, that how can we get this to the most number of people that need it, that are at higher risk, as quickly as we can. And then finally, I was asked to talk just a little bit, and I'm going to get a little bit technical here, because we get a lot of questions now that we do have 2 or 3 therapeutics out there. What are the differences between these medications? How do they work? And so I'm going to try to give just a brief discussion about that. Really 3 main medications that we have for COVID right now. One of them is remdesivir, which has been around for quite a while, and that is mainly for hospitalized patients that are really quite sick. And it is an antiviral that stops the virus from making extra copies of itself, of replicating once it's already into the cell, and tries to shut things down. So it's similar to Tamiflu for influenza, or oseltamivir. The 2 newer medications that are out are what's called monoclonal antibodies. And they work kind of upstream in the disease process. And so if you think about, everybody's seen that picture of the coronavirus, and it's got all those little spiky things on the outside. Those are actually called, strangely enough, spike protein. What these monoclonal antibodies do is they actually go and they attach to all those little proteins and coat that virus so that it can't enter into the cells and start duplicating itself. And so it prevents it from ever starting. And so the monoclonal antibodies, which are bamlanivimab and the Regeneron cocktail, yeah, we all have trouble with those names. Both of those, they work really early in the disease process. So they're really most effective is given as soon as we know that they have it in high-risk individuals, and they can stop the progression of that disease early on. Versus remdesivir, which we've had for a while, which is more for sicker people that are in the hospital, ICU, those sorts of settings, so that we can treat it once it's already established. And so that's the big difference between those medications. And so with that, I believe I'm the last talker, so I will turn it back over.
You stole my material there. I was going to explain how that worked, but thank you for doing that. So we'd certainly entertain any questions you might have this afternoon for any of the 4 of us. Don?
The question for the hospitals. How concerned are you now, 2 weeks from Thanksgiving, and what that's going to look like after a lot of people did get together?
So the question is that we've seen things level back out. what are we expecting to see because of the Thanksgiving holiday. We are watching that very closely, and it will be about 2 weeks out before we know, if those numbers start increasing again. And I think they're going to increase at least a little bit, and hopefully not too much. We tried getting that word out a lot that this is probably a year to have a little bit different holiday experience, set up some new traditions, at least for this year. And I know, talking to people, that many, many people have taken that to heart. And so we hope not to see too big of an increase, but we will be closely monitoring it.
And your ICU bed capacity is okay?
We continue at most of our major referral centers. The ICUs are running at or near capacity. And so we continue to look for ways to increase that capacity by converting other floor beds to ICU beds. And so as we need to, we will do what we need to take care of them.
Dr. Wilde, same question.
So in regard to Thanksgiving and spread of COVID, I agree with Dr. Basil. We'll see. We have two models that really anticipate a good response to a lot of the messaging around Thanksgiving, and it starts to show a decline here in the next couple of weeks. And then we have another model that does show a little bit of an increase in the case numbers with then an eventual decline. In regard to our ICU capacity, we could, as I alluded to, or as I stated earlier, our census is still very busy, and that includes in the intensive care unit. A minority of our patients are COVID. We're just continuing to see a lot of other intensive care needs at this time, but still working within our surge process and handling folks that come our way.
Any other questions this afternoon for us? All right, seeing none, thanks guys. Have a great rest of your day.